everyone, my name is Ashlee Parkes. I'm a family nurse practitioner here in Missouri, and this video serves a purpose to give you guys some education of what to expect during your first weight loss consult. And so today we're pretty much going to just be talking about the two compounded medications that we offer. Semaglutide. Semaglutide is the compounded version of Ozempic, which is for type 2 diabetes, and Wegovy, which is FDA approved for weight loss. And so our semaglutide compound medication is, it follows the Wegovy dosing, which is 0.25 milligrams, 0.5, 1, 1.7, and 2.4 milligrams. So if you opt for the semaglutide dosing, and for example, I'm going to reference Promise Pharmacy. So depending on what your prescriber prescribes you is depending on what dose. And this is all going to be on the vial that you receive. So when you receive the medication, you're going to have a vial of medicine, alcohol wipes, and insulin syringes. So for instance, the medication is, let's say we're just starting out, we've never been on these medications before. We're going to be doing 10 units. So you see a 5 here and 10. You're going to be doing 10 units once weekly for 4 weeks. And you're going to inject it in your belly or thigh. You can also use the back of your arm. You're alternating the site so that you're not going to be developing any infection or scar tissue. So most patients will do left side of the belly, right side of the belly. This medication is contraindicated in those who have a history of pancreatitis, gallbladder disease, kidney disease, or a personal and family history of medullary thyroid cancer. Your provider will also go over your medical history, so surgeries, allergies, what medications that you're on. The biggest and most important one is oral contraceptives. That is a contraindication to this medication because, as we know, this medication delays gastric emptying. Oral contraceptives are a very timely medication, and so that makes them where they're not effective. And so this medication is contraindicated in pregnancy, trying to become pregnant, breastfeeding, those types of things. So that's another contraindication. So semaglutide works on the GLP-1 receptor, which is in charge of appetite control, curbing your cravings, keeping you satisfied with what you're eating. It doesn't work very well. And so that's where these medications are so successful and so helpful for our patient population because they're less hungry. And the number one way to be successful with this medication is listening to your body. Utilizing this medication as a tool in your toolbox is exactly how it should be utilized. It is not a fix-all be-all. Unfortunately, diets don't work. We know that. And so this medication is a tool in your toolbox to hold you accountable, to be more active, to be eating less food, smaller portions. Very, very important. Fried foods, high fat content foods also do not agree with this medication. So listen to your body. When your body is saying, hey, I'm full, you need to stop eating. I have seen too many times, I would say 9 times out of 10, the GI side effects that are listed with this medication, nausea, vomiting, diarrhea, constipation, acid reflux, occur when patients are not listening to that little voice in their head that says, I'm full. They push the limits. Alcohol is okay with this medication, but know your limits. If you're used to drinking 6 beers, you might only be able to drink 1 or 2. Do not push that limit. When you push that limit, that's when those side effects happen. Suppresses your appetite, also suppresses your thirst. So be very mindful of your water intake. We usually say make a goal of half your body weight in ounces of water a day. Very, very important. So on average, I really think you should be drinking at least 100 ounces of water a day. Other side effects that I come across with patients are my hair is falling out or I'm losing so much muscle. And that has a lot to do with rapid weight loss. 1 to 2 pounds a week is goal weight loss wise. You really don't want to be losing it faster than that. Now, granted, in the beginning, you might be losing more weight because you are adjusting your lifestyle. You're more active, and active wise. You don't have to be busting it in the gym every day. You could be, let's say on average you walk 2,000 steps a day. Well, let's get moving and make a goal of 4,000. And then let's make a goal, in the end, let's try getting at least 10,000 steps a day. So this is all about a lifestyle change because research shows 75% of patients gain their weight back when they stop this medication. I personally do not think this is a lifelong medication. Some patients it is. If you do the lifestyle changes and eat smaller portions, eat healthier things, I think you can lose the weight and keep it off. Now, weight loss and maintenance are very different. Weight loss is a weekly injection. Maintenance, it depends on the patient. Some patients can go 10 days or 14 days, and it's a low dose. We will talk about that in the future. This is more the weight loss appointment. But just know, I've had patients who stay on this for a year or two and come off of it, and they do great. But our society as a whole, we're always looking for the next quick fix. There's no such thing. So goal weight loss wise, 1 to 2 pounds a week. Maybe more in the beginning, but don't get discouraged if it's 1 pound a week. That is amazing. Let's look at the big picture here. 1 pound a week in a year is over 50 pounds. We would all love to be down 50 pounds, but we're not gonna get there overnight because unfortunately we did not gain the weight overnight. So hair loss is not necessarily a side effect with the medication. It's more a side effect with the weight loss. Your body takes weight loss as a stressor. Your hair is the last thing to get any nutrients. So taking a daily vitamin, increasing your protein, usually say 75 to 100 grams of protein a day is great. That's a lot of protein. And some patients are like, there's no way I could get it. The more protein, the better, and hydration. So that's the semaglutide. Tirzepatide, same contraindications, same side effects, works on 2 receptors, GLP-1 and GIP receptor. I will say we're comparing apples to apples here. Tirzepatide is the compound of Mounjaro, type 2 diabetes, and Zepbound, weight loss. The dosing follows the same criteria. And we're gonna reference Promise Pharmacy again here. Their dosing is 12.5 units. So that is gonna look like this in the syringe, 12.5 units. Regardless of the medication, you should not see a lot of medication in here. You should not be drawing it up the whole way. That's a recipe for disaster and unfortunately could send you to the ER. We have to slowly titrate up on this medication. When I say slowly titrate up, I'm talking, we do the first dose for the first 4 weeks, once weekly, and then we go up to the next, and I recommend all my patients stay there. Stay there until you know, okay, I am not losing weight anymore, my cravings are returning. Okay, well then maybe it's time to go up on the dose. And you can always message us, hey, what do you think about this? We are here for you. We are here to help you lose weight. So we are a part of your team. And if you have any questions, concerns, anything like that at all, you want to reach out to us because that's what we're here for, especially if you're having side effects. Side effects are not normal. Now, you hear all the bad things in the media. When you give millions and millions of patients a medication, there's going to be some side effects and it's going to be talked about. But I would say for the most part, 95% of the population receiving this medication, they do amazing. Now, the tirzepatide. I would say patients feedback-wise, patients like this medication more, but it's also pricier. It is about double the cost than the semaglutide. And one, it's newer, and so it's more popular. I do patient-wise, feedback-wise, I hear less side effects with it, and they just feel like that food noise, that constant chatter in their brain is just more silenced. But going back to the semaglutide, I've had patients in their 70s lose 50 pounds. We're comparing apples to apples here. Weight loss, percentage-wise, about 20% weight loss has been seen with the semaglutide in a year, and 25% weight loss with the tirzepatide in a year. So both amazing products, both gonna help you guys get to your weight loss goals, but lifestyle changes. No diets, being very mindful of your water intake is very, very important. I have had some patients say they get headaches as a side effect. That's not a listed side effect. And I see more times than not, they're not getting enough hydration in their day. And so you have to be really mindful of your hydration because dizziness, headaches, those are symptoms you're not getting enough hydration. So be very mindful of that. We're excited to have you on this journey. Like I said, questions, concerns, side effects. I got my medicine. Now what do I do? You can always reference this video. This is a great video to watch before your appointment. You have that exposure already. You kind of already know what your provider is going to talk about. And then after your appointment, that was overwhelming. I don't know what they talked about. Reference this video. We're here to help you. And we're really excited to have you. Have a great day, guys. Bye.